Bladder cancer is a disease that can go unnoticed in its early stages, but early detection significantly impacts survival rates and treatment options. Initial symptoms, such as hematuria, blood in the urine, are often the first warning sign, although they can also be associated with other conditions like urinary infections or kidney stones. For this reason, specialists stress that any changes in urinary habits should prompt a medical consultation. Dr. Enrique Grande, head of the Medical Oncology Service at MD Anderson Cancer Center Madrid, emphasizes the importance of paying attention to signs such as painful urination, increased frequency of urination, the sensation of incomplete bladder emptying, and pelvic pain, as these symptoms could indicate a more serious underlying condition. The testimony of patients like Laurent G. reinforces the importance of taking action at the first sign of abnormality. In his case, noticing a pinkish tint at the end of urination was enough to seek medical attention, leading to an early diagnosis and timely treatment. However, it is crucial to understand that blood in the urine is not always a sign of bladder cancer. Many factors, including infections and autoimmune diseases, can cause this symptom, highlighting the need for a thorough medical evaluation before assuming any diagnosis. Early detection of bladder cancer is key to improving the chances of recovery. When a tumor is identified in its initial stages before it spreads to other areas of the body, treatments can be less aggressive and more effective. In cases of superficial bladder cancer, which is confined to the bladder's inner layer, procedures like transurethral resection of the bladder, TURBT, offer success rates of 80 to 90% in terms of long-term survival. This means that in most cases, patients can continue their lives with minimal impact on their quality of life, provided they follow appropriate monitoring to prevent recurrence. On the other hand, when cancer is diagnosed at a more advanced stage and has invaded deeper layers of the bladder, treatment options become more complex. The long-term survival rate in these cases drops to around 50%, reinforcing the need for combined interventions such as surgery, chemotherapy, and immunotherapy. In recent years, advancements in immunotherapy have opened new possibilities for patients with invasive bladder cancer, improving treatment responses and offering better quality of life compared to traditional approaches. The message from specialists is clear. Paying attention to early signs, such as changes in urination, can make the difference between an early diagnosis with high chances of recovery and a late diagnosis with more limited treatment options. While blood in the urine should not cause panic, it should also never be ignored. Raising awareness about these symptoms and encouraging regular medical checkups are essential tools in reducing the impact of bladder cancer and improving survival rates. The outlook may seem concerning, but medical advances have significantly improved the prognosis for many patients. Innovations in diagnostic techniques, along with more effective and personalized treatments, have allowed more people to overcome the disease and return to their normal lives. The key lies in awareness and early action. At the first sign of urinary health changes, the best decision is always to consult a specialist.